Good morning, and thank you for joining us for today's Children's, Youth, and Family Policy Institute for Eastern North Carolina. My name is Dawn LeBlanc, and I am the Training Coordinator for Prevent Child Abuse North Carolina. Just a few things before we get started. Today's Institute is being recorded, so all microphones have been muted and all cameras have been turned off. If you have a question, about technical issues, please use the questions tab to the right of your screen if you are having problems hearing or seeing any of today's presentation. All registrants for today's webinar will receive the documents discussed during today's presentation, a recording of the webinar, and a brief survey of your experience today. Now I'll turn it over to Malia to get things started. Malia?
Hi, everyone. Good morning. Welcome. Thank you all so much for joining us for the 2020 Regional Policy Institutes. Welcome, everyone from Eastern North Carolina. We're so glad to have you here today. My name is Malia Rose Waters. I'm the Policy Director with Prevent Child Abuse North Carolina, and I will be joined today by my co-facilitator, Adam Sotok from NC Child. So our planning team and our sponsors have been so excited to bring you today's lineup of speakers. We will be welcoming in a few minutes Deputy Secretary for Behavioral Health and Intellectual and Developmental Disabilities, Cody Kinsley. He is our opening keynote. He will be followed by an Advocacy 101 presentation from Ann Rodriguez, who's the Assistant Director with Eye to Eye Center for Integrative Health. After her presentation, we're going to take a short break, and then when we return, we're going to hear from our Parent Voice keynote, Stacy Justice, who's the Associate Director with NC Families United. And then we're going to wrap up our time together this morning with a legislative panel discussion featuring Senator Don Davis and Representative Donna White. I just want to make note that the panel discussion is not interactive. It won't be a live Q&A with the audience, that we will be asking them questions and they will be responding to those questions. So first, I would like to share with you all a brief welcome that Governor Cooper has recorded to welcome you to these institutes.
Hi everybody, I'm Governor Roy Cooper. Welcome to the 2020 Regional Children, Youth and Families Policy Institute. As we've faced unprecedented challenges this year, I've seen North Carolinians rise to the occasion, working to protect their loved ones from this virus and going the extra mile to help their neighbors. That spirit is what makes me confident that we'll emerge from this pandemic a stronger and more resilient state. As we work to make things better, we need to ask ourselves, how do we help ensure all children grow up in a safe, stable, and nurturing environment? This institute will provide critical information and strategies needed to answer that question and support children and families across our state. As you hear from experts about the issues that impact the well-being of children the most, I hope you use what you learn from each other to help your own communities. Thank you to the people who made this virtual event possible, and to all of you for participating today. Your efforts are making North Carolina a better place for children and families. Thanks so much.
All right, thank you so much, Governor Cooper. Now I want to turn it over to Deputy Secretary for Behavioral Health and Intellectual and Developmental Disabilities, Cody Kinsley. Welcome, Cody.
Hi, thank you so much. It's such a pleasure to be here with you all, and it's such a pleasure to follow the big boss, Governor Cooper. We're so lucky to have his leadership, especially right now at this incredibly difficult time for all of us. Had the real pleasure of working closely with Secretary Cohen and his team as we've worked to respond to COVID. And I can say that he has been intentionally and engaged in the details every single day of our response. And the thing that leads him constantly is making sure that we're taking care of North Carolina families with every policy choice we make that impacts the state. So we're really, really grateful to have his leadership, who's been committed to the right public health strategies the entire time, who's been consistent and stable in messaging, and I think been a really phenomenal leader and voice for us all to look to for stability at this incredibly chaotic time. But to the purpose of us being here today, I want to thank Adam and Malia for everything that they've done, and everyone else that's been engaged in coordinating these regional policy institutes. The team was reminding me that we were hoping to do these on the road together. Many of you may know that we had started with a series of town halls sometime last year coming into the new year, and we're having a lot of fun, but unfortunately, as COVID has impacted all of our lives, we've shifted to a virtual format. So we weren't able to tag team with our state town halls and these events like we wanted to, but I'm glad that we can be together virtually, and I hope that many of you will join us in our virtual town halls, which we've re-kicked off a few weeks ago, and we'll have our next one in a few weeks from now, and you can surely find all that information on our website. The other thing you'll be able to find on our website today will be all of my remarks, so they are there, so don't feel like you have to pencil down specific notes. You can find them there. So let's dive in. COVID-19 has been an unprecedented public health emergency, and I know that it's felt like a really long time. Myself, I'm feeling incredibly fatigued, if not tired, and I know that all of us are feeling this, and we're feeling it in all aspects of our lives, and it's having an impact on our behavioral health and wellness as we try to move through this significant and sustained event. The other thing we know, in addition to the duration, is that truly no one is untouched by this. whether it's the disruption of our daily lives, the really tragic impact of individuals and our family members getting sick, whatever's happening. It's a really tragic time, and we're all being touched in some way. But I remain hopeful for many reasons, because of the things I opened with, because of our leadership, the excitement of doing the right thing, of being focused, of being data driven, of taking care of people and watching the impact that's having in saving lives in North Carolina. It's an exciting endeavor to be a part of, and we're proud of that success. We've avoided large surges in cases in COVID-19 compared to numerous other states. Our healthcare system has not been overrun in the way that we've seen in other states and cities. We've been able to continue to serve COVID patients and non-COVID patients as well in our healthcare system. And I'm really grateful to all the partners who have worked really hard to make that possible. We've organized our response around 4 key pillars, and I want to talk a little bit about those today. First, prevention. We've all heard it said, an ounce of prevention is worth a pound of cure, and if you give me too much more time, I'll start singing Mary Poppins. Nevertheless, organizing around prevention is number 1. Number 2, testing. We have to know how to treat people and how to respond and what to do through diagnostic testing. 3, contact tracing. We need to know who people have been in contact with if they potentially have exposed themselves to other individuals inadvertently, to make sure that they can be removed or isolated from exposing to other folks. And then, of course, isolation supports. That's our 4th pillar. It's not easy for everyone to isolate. It's much easier said than done. Not everyone has paid leave. Not everyone has access to health insurance. Not everyone has access to stable housing. And so having the supports you need to be able to isolate are critical to stop the spread of the disease. And I know many of those issues I just talked about are several of the key issues that we think about as this group in thinking about protecting families throughout our state. So while we've focused on those 4 key things, I want to dive in a little bit into each of them from there. You know, we have had a lot of success, but we've also, I think, in seeing COVID-19 and the impact, it's highlighted and exacerbated existing challenges in our healthcare system. So I don't think that we've seen new surprises. It's really been the things that were always there, but now we're shining a bright light on them, and in particular in our behavioral health system. So despite the difficulty that the virus has created, you know, I feel like the things that we had set out to do in fixing our behavioral health system now are just even more important, right? It hasn't changed the goals that we have. If anything, it's made us double down on the effort. Goals like increasing access to the right care at the right time in the right setting. There are very few children in this state that don't have access to health insurance, yet the average child will wait 4 months to see a psychiatrist. That's unacceptable. And that's an issue of insurance adequacy. That's an issue of network coverage. Making sure that behavioral health care is integrated into primary and physical care, right? We can't treat behavioral health solely as a specialty service. We have to treat it also as an accessible service for anybody as part of a primary care regime. 1 in 5 people will experience a behavioral health issue in a given year. We need to make sure that that 20% of the population have access to some sort of service. We need to make sure that we're improving our oversight of the behavioral health system. We make investments in the public system. We need to see impact that drives outcomes and value for people's lives. And we need to make sure that we're watching that happen. We need to optimize performance, but make sure that we have safeguards. We need to make sure that the system is driven by outcomes for people and not other things. So we believe that we were right on track for the goals that we wanted to focus on leading into the pandemic, and we will continue with that focus. I think the other thing, and just to double down on access, and you'll hear me mention this several times, is that COVID-19 has really highlighted for us how inequitable access is throughout various populations, whether it's old or young, or people of color or people not of color. We have a lot of historic systemic issues, especially in Black and Latinx communities here in North Carolina, where people don't have access to care or don't have access to culturally competent care that can make a meaningful impact on their lives. And we have to continue to work to improve that. Again, I am so thankful to the governor for his leadership, as he's also, in addition to focusing on COVID-19, he's lifted up our behavioral health system as a focus on our mental health care as part of our response. Many of us here today are engaged in work supporting children because of our personal connections to this work. We've experienced and navigated overly complicated systems, and we've seen individuals go without care or the services that they need. So for me, I think our greatest goal that we'll always remain focused on is that we have to have family members with lived experiences at the table as full partners in planning and implementing services, to make sure that that happens. I think that, I so often talk to families that are experiencing issues with their children or other loved ones in their lives, and they're a care partner. They help navigate folks. And so making sure that we have family members that have built this great expertise to be at the table, not only in the care of their individual, but frankly in the policymaking circles, and also in the space where they can be part of our system of care more functionally, is a key priority for the department. We won't be able to ensure access to timely and high quality services without families being a part of that key treatment puzzle. But I am just sort of preaching to the choir here. I think all of you know this better than us. We know that the public system right now has too many factors that are limiting its performance. It puts the onus on you. It puts the onus on families to walk through the door and navigate. I think it's such a tragedy that individuals in the highest stress moments of their lives, when individuals are going into crisis, that's when the highest burden is placed on individuals to navigate, and we have to make that system easier. Many of you have heard me say before, if you have to know my organizational structure, then I have failed. Right? Because you only know my organizational structure if something isn't working. But if things are working, then you don't care about the organizational, you don't care about who reports to who or where I sit in the organization. You care about the services are just working and they're built around individuals. We have to continue to redesign our system. We know that we have real barriers created by insurance. We have 1 million people in this state that don't have access to health insurance. And while I mentioned earlier that most children have access to health insurance in North Carolina, we know that not all insurance covers all the services necessary. We know that there's a lot of families that are hungry to get into Medicaid or to other public systems because of the more rich benefits that are available, especially on certain waivers, where private health insurance isn't bringing that same level of support to families, which is critical. We know that we have a lot of differing administrative policies across the state, and that's confusing and perplexing. And when people move from one catchment area to another, or perhaps one insurer to another, things can feel dramatically different. And again, the transition of moving should not be further exacerbated by the trauma of having to navigate other new care providers that may no longer be available. And that also means having available providers across the state. And so we have to continue to focus on this. I apologize, I'm just going to take one aside. My dog is with me, so the wagging and the tail, I apologize. This is my mental health coping mechanism to have him here with me, and I hope that that's okay for folks. So I know that, again, I am telling you things that you know, but I want you to know that we know it too. And I want you to know that the stories you share, the experiences you have, my personal experiences from growing up in North Carolina, being here my entire life, my parents living here, growing up without health insurance, myself, my parents navigating the system to try to cobble together services. It's really challenging, and it's been happening far too long, and we have to step up. And it's not just the state, but it's all of our private partners, it's our providers, it's our insurers, it's everybody stepping up to do the work that we need to do to fix these issues. So I just want to dive a little bit more into the details to make the point about why this work is so important. And I know beyond just the personal experiences we've each had, but in the data that bears out. For instance, youth do not have the same high rates of comorbid physical rates as adults. So this is, while we see that comorbidity of physical illness more often in adults, national data tells us that children served by Medicaid using behavioral health care are 11% of the population, yet consume 36% of the expenditures. So we also see that children bear out significantly more services in spite of not having those comorbid physical health needs. We also know that children's behavioral health needs are fluid. Their diagnoses change, their level of case required can rise and fall, and often our system is not nimble enough to address those needs. Children with behavioral health needs that are multi-system involved are particularly, the children are complex, but our system unfortunately is too complex to serve them well. You know, at least 2/3 of the youth and child welfare are estimated to have behavioral health needs. Current North Carolina juvenile justice data indicates that at least 90% of kids in juvenile justice system have behavioral health needs, 90%. And I think this data can be illuminating on systemic barriers to care for children based on factors like their race. A North Carolina pilot study with cross-system involved youth found that white youth receive more services for diagnoses for depression, anxiety, and trauma or stress as compared to African American youth. Youth of color in the justice system receive fewer behavioral health services than white youth. And youth of color served in the mental health system are more likely to be referred to the justice system than white youth. So we see systemic access issues and we see unconscious bias throughout the service system, and people fall in the gaps or get routed in different paths depending on the color of their skin. And that is unacceptable. We must do better. And so we have been working on improving our system of care, and we have much further to go, and it has been in the partnership with you all to make this happen. These challenges that I'm outlining really underscore why this work is so very important. And we have a vision that we can achieve together a proactive, responsive, resource-enriched, and outcome-driven child behavioral health system that leads to children and families thriving in their own communities. And a key way to accomplish this, as I've mentioned already, is to apply the system of care approach. This, along with supportive policy development, expansion of community-based services, public-private community partnerships, and strategic decision-making can make this goal a reality. And in some instances, it already has. And I want to share a few examples of what can happen. In 2012, by employing the system of care principles, Durham County decreased the number of out-of-home placements from 52% to 32%, a 20% reduction, and essentially half overall. While this approach yielded better results for many children and families, it has also had a significant fiscal impact. The county cost of residential care dropped from $3 million to $700,000, a significant financial savings for the county that would allow the county to invest in more prevention methods. Again, an ounce of prevention, pound of cure. And so this success was achieved by creating a care review process. As part of this process, representatives of the local public child serving agencies, families with lived experience, local private partners, and community organizations met weekly in a wrap format to review the profiles of youth that were poised to go in out-of-home placements. They worked together, they came up with strategies to keep these youth in their homes, providing access to special and innovative services. They partnered with their families to understand what they needed. They worked to support the families as well as their caregivers to make sure that everybody felt like they could do this together. And our local management entity focused in Durham also educated juvenile court judges about what residential care could and could not do. This is another critical factor. We often engage with juvenile court judges and other entities that have views on trying to serve that child, and a residential care facility feels often like the right option when it is often not. And so making sure we had those experts around providing that care and family members at the table to make sure that we could show the success is possible within the family, and instead of doing out of place home. And lastly, the Durham System of Care Leadership Group, made up all these key child serving decision makers, met monthly to then look at ways that local policies and administrative procedures could be changed to better support these youth, and then were shared with other systems. So I think that what we see here is we see a ground up approach in looking at the system of care. Every child, every family, every system, and thinking through how all of it works together and how do we wrap folks to serve folks better. Now, this is an example from 2012, and the world has definitely changed a bit since then. But the same system of care principles are baked into this approach, and I believe that they are in the 2018 Families First Prevention Services Act. We're excited for this. This act, for those of you that don't know, has really changed the landscape to federal child welfare funding in significant ways to support children to remain safely in their homes and encourage family-based placement when foster care placement is necessary. With specific requirements around evidence-based programs and tools, the legislation expands opportunities. It uses research and data to drive decision-making and direct funding to ensure that children and families receive the most effective services. Certainly a very important step forward. Other states' experiences can be instructive for us here in North Carolina on what to do. New Jersey has implemented the system of care approach, they've been able to increase access to care, decrease over-reliance on out-of-home treatment. They've produced a decrease in over-reliance on detention and a decrease by 70% of the population of youth who are on probation. This is instructive for us. It's particularly notable since this was accomplished within a managed care setting, which is the world in which we are moving towards holistically and where our behavioral health system already operates. As you know, while we have paused our Medicaid transformation work, thanks to the great collaboration with the General Assembly, we have restarted our work to shift from a fee-for-service physical health environment to one grounded in managed care, where physical and behavioral health care are integrated and coordinated far more effectively. Again, removing one of those chasms where so many families have struggled to navigate. How do I patch together fee-for-service services for children for physical health versus their behavioral health coordinated services, and having other individuals looking at that wrap as opposed to just bearing the weight on the family. We believe that this transformation and this integration will produce far better health outcomes for beneficiaries and the state as a whole. And I'm sure you've picked up on the key elements of this approach over time as we've been talking about it, but it's the same thing we're talking about today. It's around partnership and collaboration that place the child and the family at the center of their work. Because multiple systems are involved in this approach, thinking of New Jersey, the high quality service coordination, such as high fidelity wraparound, is critical for youth to get what they need, when they need it, and in the least restrictive setting. This also lays the table for potentially sharing resources and costs to make incentives so that it's not just about billing to cover costs, but it's about billing to maximize the value for the individual being served. We have to work across child serving systems to identify shared challenges to create solutions without violating any system's legal parameters. So as we pull these systems together, we can wrap things around kids. I'm proud of the work that we have with 69 collaboratives to support this kind of cross-system work across the state. These are emblematic of the core elements of NC systems of care: family-driven youth-guided services, interagency collaboration, service coordination, individualized, strength-based approach, culturally and linguistically competent care, evidence-based or informed services provided in families' home or in the community. Orienting our work at the Division of Mental Health around evidence-based practices has consistently been a priority for DMH. Nowhere else is this more crucial than in behavioral health care for North Carolina's children. These core elements are integrated in the division system of change approach that is currently underway. So let's talk a little bit more about what is on the horizon for us and what's next. We're working collaboratively with our colleagues at Medicaid here at the department to develop a family peer support definition under Medicaid that will improve the opportunity for children and families to move through the public system and to get the services and assistance they need. I'm really excited about this. It's going to help meet families' needs, and it's also going to help families assemble their own resources to avoid having to go deeper into the system of support. We're implementing child residential treatment initiative to improve outcomes for children by training providers on evidence-based practice and strategies, supporting their clinical practice with policy change, and working with the families and communities of the children to ensure children and youth thrive upon their return. We're also building on current pilot projects to provide for Latinx family supports and leadership building to reduce homelessness and significant behavioral health issues within the LGBTQ communities. As I start to wind down this morning, I want to end by reinforcing why events like this are so important. We have families with lived experience, we have cross-agency public and private representatives, and we have other community stakeholders wanting to understand child public policy so that they can be educated. They can be an educated voice when talking to policymakers and decision makers on behalf of their communities. Learning and working across these systems is the most important thing we can do. I think we have talked several times this morning about how people fall through cracks created by the system as constructed. And to break down those cracks, to wrap systems and services around people, we have to have collaborative events like this to understand where other folks are coming from, the experiences that they have, the goals that they are trying to achieve, and work together to come up with mutual goals and mutual objectives that navigate these systems independently, but as one, to make sure that we're wrapping around individuals. Learning and working across these systems is the only way that we're going to conquer the barriers that families face when they start to enter this maze of public child service systems. And not just, and I want to emphasize that it's not just about us putting the onus on individuals to learn significant amounts about the other systems. It's also about us redesigning systems and changing the way it works. That's what we're doing with Medicaid transformation. That's what we're doing in our implementation or our work towards the Family First Prevention Services Act and other work. We appreciate your feedback and your guidance in making sure that we're doing the right thing to redesign these systems. You know, the policy and research work group of the state collaborative have brought together many members of the local system of care community collaboratives, and I want to applaud the state community partnerships. These collaboratives are critical and core of our public service systems, and you, the family members, cross-agency representatives, and community stakeholders are the heart and soul of communities. You're here to become strong, powerful voices when Medicaid transformation begins in earnest, and you'll help hold us accountable. I'm deeply grateful for you and your efforts for our children and our state. And I want to thank you all for having me today. I am confident the rest of today's program will be illuminating and informative, and I look forward to hearing from you all.
Thank you so much, Deputy Secretary Kinsley. That was so wonderful to hear. And I just want to share a remark also. Well, Adam can. Adam, would you like to share your in the
No,
chat?
I just want to say thank you as well, Cody.
Yeah.
Thank you,
Yeah,
Adam.
it was really, we had a couple of comments in the chat that this was awesome. Really, really appreciate it. Also want to remind everyone that your remarks will be on your website if people want to go back and refer to them, correct? Where can people learn about your town halls? Where can they go to learn about how to attend?
They're also, if you navigate to the DHS website and find my bio page, you'll find everything I've ever said, every presentation I've ever given, and the schedule of events of everything I'm going to do ever. And we put it up there. So one of our, I think folks know the values that we have at the department, and one of them is transparency. And so we want to make sure that you know where I am. I work for you, and so I appreciate the honor to be in this role. So it's all there.
Thank you.
Cody, if you don't mind me asking you a question, just to kind of segue into the Advocacy 101. In the town hall meetings, what kinds of things are you looking for? What kinds of comments, and how will they be used?
Great, thanks for that. So I think in the town halls, you know, we have been talking about this vision for where we want to head with behavioral health for some time, right? And we continue to get deeper into this work, and we want to make sure that folks are organized and coordinated around this. For me, we've been talking a lot about our work in justice-involved populations and our work in schools, trying to move that forward. So trying to get feedback and input. What are people's experiences on the ground? What is or isn't working? Personal stories to build awareness around this. And also, frankly, to coalesce around that, to your point around advocacy, around how do we all stay focused on common vision and mission. The thing that we're hearing a lot in the the conversations we've had so far, both before we went virtual and now, have been a lot of questions around the waiver waiting list. I know that's a critical thing that folks are really focused on. It's something the department has long been focused on, and I'm sure will be a subject of conversation in your legislative panel today. I think folks know that the legislature budgets for a certain number of slots. That has been a relatively stable number for some time, even while we have a large number of people on the waiting list. We'd like to have more folks on slots. We'd like to not have a waiting list at all. And short of getting more slots, we have been providing as many states, the diminishing state dollars we have for the million uninsured people. We have been using some of those services and dollars to help support individuals that are on the waiver waiting list. That has been a really hot topic of conversation. And I know it's something that together we're going to have to work on with our legislative partners to make sure that we can really move forward there. There's so many other investments that we need to make, and but it's the right thing to do, and I hope that we can move that direction.
Great, thank you so much. And we had a couple more comments come in that thank you, good question, and really appreciate you taking the time to answer that question. Thank you for being with us this morning.
Thank you. I'm going to hang out, so over to you, and I'll be watching it. What's up?
Excellent. Well, next I'm going to turn it over to Ann Rodriguez from IDOI Center for Integrative Health, so she can share with us on Advocacy 101.
Let's see if I can share my screen. All right, so you tell me, Malia, when you're seeing it.
Yes.
You're seeing it now?
Yes.
Okay, so let's get the slideshow started. Good morning, everyone. As Malia said, I'm Ann Rodriguez, and I'm the Assistant Director of the IDOI Center for Integrative Health. And I'm really happy to be following Deputy Secretary Kinsley. He said some really important points. One, his invitation to you as family members and advocacy organizations to participate and have some meaningful impact in policy, I think is incredible. It's an incredible opportunity. And the other thing is about system of care. And that's something that we've been working on for a long time in North Carolina. It's a resource that's already there. And there's a lot of room for it to grow and be a part of the Medicaid transformation, Medicaid managed care, and our move to whole person care and integrated care, and really looking at what do we need to do as a whole well-rounded approach to help families and children and youth. So let's get started with Advocacy 101. I wanted to tell you a little bit about myself. I grew up outside of Washington, D.C., and when I graduated from college and I didn't know what to do, my parents suggested that I work on Capitol Hill. So I did. I worked in the U.S. Senate for 6 years. And actually, that was the time that I discovered that I am a true policy wonk. I love policy and legislation. I love working on it and seeing it come to fruition. So I've been so fortunate to work in North Carolina in the MHIDD SUD system for several years now, advocating and lobbying on policy and legislation. But my biggest advocacy role started when I became a parent. My oldest child has a learning difference and she has a health impairment. So I have had to learn to be a strong advocate for her, for what she has been doing in school and for her future. And so I bring all that to the table today. I also want to tell you a little bit about the IDOI Center for Integrative Health. You can see our mission here is to foster collaborative and evidence-based initiatives. I'm going to move the screen I'm looking at here, and for improving the quality and efficacy of behavioral health, IDD, and SUD support systems. And we do that within the context of integrated care and whole person care. And we also do that through 3 different strategies. The first one is to convene stakeholders and bring everybody equally to the table to discuss policy issues, legislation, just issues that are impacting our system. And the second thing then is to strategize what are solutions to those issues. And when everybody is at the table with that equal voice, they're also bringing their resources to the table. So hopefully we're getting solutions that work for everybody to a great extent. And that last piece that we work on at the IDI Center is activating that change. And that's where the advocacy comes in. So I wanted to start with what is advocacy, and I'm doing a little shout out to Ruth Bader Ginsburg with her creativity on how to wear a robe and the collars. To advocate is to defend or promote a cause, but the most important thing is that advocacy is active. It means that you are doing some work, you're doing some outreach, you're putting yourself out there. It is not passive. Advocacy goes beyond changing or shaping legislation. It's about system change. And I just wanted to note, but I'm not going to really get into detail today, that for nonprofit organizations, you can do advocacy and you can do lobbying. There are some rules around your lobbying, and just for you to be aware of that. Right now, we have a lot of craziness going on. Everybody knows that. We've talked about that a lot this morning already. But with craziness comes opportunity. And opportunity is for you to get out there and advocate and present your perspective, because your perspective is so meaningful to the community and how things can really realistically be implemented. So to look at those opportunities right now, we always have the issues around funding and availability for community-based services. Deputy Secretary Kinsley talked a lot about Medicaid transformation, and that is a big shift in our state right now, going to Medicaid managed care and integrated care. There are always innovations and early childhood interventions that we're looking at, and we want to be sure that we have them available to us in North Carolina. We're looking at health equity, and that has really risen up in awareness, and it's important to take advantage of that time. Health equity and racial equity. And then that concept of the value proposition of care, and what does value mean to anybody, whatever your perspective is. What is the value of care is a really important thing for us to frame up in a way that works for families and children and youth. So you can become a resource for difficult decisions, because of course, child and family involvement and advocacy efforts can have a huge impact. So there are many places that you can use your advocacy skills. I'm going to focus on two places today. One is with elected officials, and particularly with the North Carolina General Assembly, and another is with policymakers. And Deputy Secretary Kinsley is an excellent example of one of our wonderful leaders that we have right now in our state, and who is developing policy. So let's start with elected officials. You all may recognize at least one of these buildings, probably. The one in the white, the white building, the one in the white is the legislative building in Raleigh, where the General Assembly meets. And the glass building is the Greenville City Hall, where you have your mayor and you have other elected officials. But let's focus on the General Assembly and their legislative sessions and their interims in between those sessions. So this gets into the detail. The state budget runs in 2-year cycles, and each cycle is called a biennium. The General Assembly meets every year. They have a session every year. But the first year of that biennium, of that 2-year cycle, is called a long session. And it's simply called a long session because they meet for a longer period of time. And the second year is called the short session, which is usually just a couple of months. All of that leading up to the beginning of the fiscal year. When they start a new biennium in the General Assembly, it is a fresh slate. Everything is new. All bills have to be introduced. There are no bills that are just right there and already in play. Everything has to be introduced, even if it's been considered in the past. So right now, the General Assembly is not in session. They finished up a short session, so they're going to start a new biennium on a long session, and they will come back on January 13th, 2021. And that long session will begin that budget process for the next 2 years. So in this particular long session, they'll develop the state budget that starts state fiscal year July 1st, 2021. And they will also develop the budget for the second part of the biennium, the state budget that begins on July 1st, 2022. The long session is, as I said, when bills are introduced, but the bills have to meet some deadlines. They have to meet what's called a crossover. And if they don't do that, they do not remain in play. If they do meet those deadlines, they stay alive for the next session, for the short session, and can be considered at that time. So let's talk a little about the short sessions. We just finished one. The next short session will begin in April or May of 2022. And as I said, the state fiscal year budget that begins on July 1st of that year will have already been developed. But they will use that short session to tweak that budget. And I have tweak in quotes because sometimes it's a very big tweak and sometimes it's a very small tweak. And it really just depends on what has happened. If there's new information or new circumstances that they need to consider, they will do that, and they have the flexibility to do that, to change that second year of the biennium budget and make it work the best for North Carolina. This past short session was just a little bit different because we had the pandemic. They were addressing COVID-19, what our state needed. They had a tremendous amount of federal funding that was allocated to us that then they needed to get to the local communities and decide how they needed to get it to the local communities. So going to bills that were introduced, going to that the session, the biennium that we're coming up to, bills that were introduced in 2021 and then met those deadlines could continue to be considered in that short session. And you can also consider other bills that have appropriations or funding that's attached to them or have some special circumstances. And then there's the interim period of time. And that's not a dead air kind of time. It's actually a wonderful opportunity to really get to legislators and talk to them when they're not in the chaos of the legislative session. And they actually do continue meeting in some capacity. In the interim, they meet in joint legislative oversight committees often, and also some special committees. And these committees take a little deeper dive into issues, and they formulate recommendations, and oftentimes, and pretty much all the time, those recommendations are then turned into legislation that's introduced in the next session. Right now, and actually right now, there's a joint legislative oversight committee meeting going on, and the key interim committees that I track and that you may be interested in are the Joint Legislative Oversight Committee on Health and Human Services, the Joint Legislative Oversight Committee on Medicaid and Health Choice, the one that's meeting right at this moment, the Joint Legislative Oversight Committee on Education, and then the House Select Committee on COVID-19. So we're going to talk a little bit about meeting with legislators and policymakers, because when you build that relationship with them, then it's available to you, and you being a resource is available to them at other times when issues come up and they need that expertise that you have as a family member or as an advocacy organization. So you want to begin and build that solid relationship and build that respect and that trust that you can have. That's really important. You have this information and knowledge about how things are carried out locally and what they mean to you as a family member or to you as a nonprofit organization. You have some information that they don't have, and you have that to offer to them. So grassroots advocacy is really very important to our system. Educating legislators and policymakers about when they make a decision, how that carries out for you and what that means for you. Is it realistic, and does it really get at what your needs are? Is a really important part of building really strong policies in our state. So you create that trust and you offer that assistance. The first thing that you want to make sure that you do is that you do a little bit of homework and you know the issues that you're talking about. And you create a message that's meaningful to you, it's a priority of yours, and that it's pertinent to things that they're considering. So the first thing is to identify your priorities. You really can use that as kind of a North Star. This is what we really care about. This is what's really meaningful to us. And to go back to it again, to look at and say, are we really getting at what we care about? Because there are just a plethora of issues that come up, and you could get overwhelmed by that. But identifying your priorities really helps you to hone in. And then it also helps you to decide who are the key legislators or the policymakers that you want to have that relationship with, or you want to make contact with. And then you can create your message. And most importantly, you can get your message out, because that's a part of active advocacy. So I wanted to give you an example. Eye to Eye Center has been doing some work for the past 2 years with the North Carolina Collaborative on Children, Youth, and Families. We've really enjoyed doing this work with them. And they have really kind of honed in on one major goal that they have, and that is to influence and support legislative provisions that provide clear values and mechanisms for children, youth, and family involvement in policies, service structures, and cross-system structures. And the two probably most important words in that are influence and involvement. That's their key, is to make an impact as much as they can so that the children, youth, and family voice is considered on the front end of developing legislation and policy, and not just when it gets out into the community. We did an exercise where we identified the priorities, we got that one main goal, and we looked at what are the key words that we really want to track. And so those words that are in blue are just an example of some of the words that they put together that are important to them. And the reason that that helps us is because we can do then searches, we can look at legislative committees or policy committees, and we know what's meaningful to us. It's really related to those terms. And again, it kind of keeps you on track with what your priorities are, so it doesn't become overwhelming. There are a lot of legislative committees that you could be looking at, and that can be overwhelming in a second. It'll be overwhelming. So you want to key in on those legislative committees that focus on the terms that you've chosen. It also helps you, there's a legislative database on the General Assembly website. I use it a lot to pull up bills. You just want to see what they're doing, what they're considering, what are the bills that have been introduced. And so you can use that legislative database, and you can use your key terms. You can put in child and mental health and appropriations, and it'll pull up any bills that have those terms in them for you to look at and kind of choose what you want to follow. And then when you're trying to track policy, you can get on the department's websites, and I would suggest using the department websites and put in your key terms. And I'm saying that because historically, in my work, I've been working a lot with the Division of Mental Health, but things have grown in the past few years with Medicaid becoming such an important funding source. The Division of Health Benefits and NC Medicaid are very important. When we're looking at children and youth and families, social services is important, and early childhood intervention. So you want to kind of broaden your search as much as you can. So as an advocacy organization, you want to encourage your constituents and members to be an active advocate, to really step out, do that outreach, and get their point of view and your point of view and your messaging out there. And again, by pinpointing those priority and goals, it helps to make it less daunting. You can help them connect with resources that keep them updated. There are just so many websites that you can look at, but you may decide that you have a few that you know are go-to, that they really help you. Every time you go to them, there's some new information that you hadn't seen. You can link to legislation, because not only can you pull up just what the names are, but you can look at the whole history of legislation. You can link to rules, and you can link to policy changes. And it's really important to kind of keep updated and know what the issues are for the context that you have when you're talking with elected officials and when you're talking with policymakers. You can track on key legislation and policy issues that you've prioritized. And then that helps you develop your message and focus on your priorities. But I would absolutely encourage you to add your personal message at the same time, because what you have experienced and what your perspective is what makes it different, and what makes you different, and what makes your message different and important. So you can use that messaging not just to contact legislators individually, but you can use them for alerts to your constituents or members. You can use them for fact sheets or for newsletters. And of course, now we want to use social media. We can tag people, and always we can do it in a positive way that we're connecting them with the good work that they're doing on the priorities that we care about. So an example of advocating by correspondence is just one that I have done myself. I wanted to use that as an example. So the priority issue is to support continued funding for the grant and aid to support kids with learning differences who require alternative school settings. It's about funding, and it's about appropriations. So who should I contact? Well, the legislature is the place where the budget begins. And so I want to contact legislators, and I want to look at which legislators should I contact. And I certainly would contact my legislators, but I want to broaden that a little bit and contact legislators who are going to have some decision-making ability early on in that process of funding that program. And so I look at the committees that might be considering legislation around the grant and aid program. And that may be legislators who are sitting on education committees and certainly on appropriations committees. And how should I contact them? Well, for this particular example, I'm doing an email or a letter, but you could also do an in-person visit or a virtual visit. So here's the sample correspondence. Dear legislator, I am the parent of a wonderful 18-year-old senior in high school. My child has a learning difference that has made it necessary for her to learn in smaller classroom settings. I greatly appreciate that the legislature has provided grant and aid funding for families of children with learning differences. These children have more success in schools with smaller classroom sizes. I know you will be considering the budget this year, so please continue your support for the funding of the grant and aid program for children with disabilities, because your support will help my child reach her potential as a student and later as an independent and successful adult. I'm happy to serve as a resource, so please feel free to contact me if you have any further questions or comments about the grant and aid program for children with disabilities. Thank you for all of the great work that you do for North Carolina, and then give my name and my contact information. So a couple of things that I want to point out in this letter. The lettering that's in blue is a link to the grant and aid program, and that will give the legislator easy access to more information about the grant and aid program. They may have seen it in the budget, but not ever really looked at what it did. And here I am as a parent telling them how important it is to my child's future. So I want to give them a link that gives them a real quick go-to resource on what it's about. The other thing that I wanted to point out is the lettering that's in bold. That's the exact way that that program is written in the budget. So they have a one-to-one context of what they're going to be looking for in the budget when they think back to my letter and what's important to me. And then, of course, you always want to thank them for the great work that they're doing, the time that they have taken out of their lives traveling to Raleigh and getting into the chaos of the legislative session and all of the work that they do for North Carolina. And then give your name and always give your contact information. So meeting with an elected official, and this is a face-to-face or a virtual meeting that we're talking about. You are probably one of many people who are very anxious to talk to that elected official. So don't just show up, because they have schedules that are very tight and go minute to minute sometimes. So I would highly recommend that you contact that elected official to set up an appointment. The North Carolina General Assembly website, ncleg.gov, has member web pages for every person, every legislator who's in the General Assembly. You can go under the House or the Senate, and then they have member lists. And each legislator has a legislative aide, and that is the key person who can help you set up an appointment that works for you. So that can be an in-person appointment, it can be a phone call, it can be a virtual meeting. I would highly recommend that you be on time, even though they're so busy and you may actually have to wait. When the legislature is in session, as I've said, it's chaos. And even when they're home, other people are trying to get a hold of them. But you want to be sure that you're on time, because oftentimes you only have about 15 minutes with that legislator, and you want to use that time to the best of your ability and to your greatest benefit. So you get there on time, and you make sure that you're getting time to get your point across. Some additional tips, and some of these I don't think I even need to say, to present yourself and your views in a respectful, dignified manner. You may not always agree between you and the legislator, and that's okay. They understand that, they know that, and they're prepared for that. But you still have a point of view, and they are there to hear that. You take or you provide written material that is helpful to them, and you leave a card or your contact information, because as you're walking out of their office, somebody else is walking in with a different message. And so what you want to make sure that you have there for them is a resource they can go back to. They can remember at the end of the day, I know I met with a very important family member, and I want to go back and look at what organization that family member is affiliated with. And I want to remember and refresh my memory what that issue was. So you want them to have that written material. If you're meeting with them virtually, you may want to send that written material electronically to them prior to the meeting so that you can share it and they can be looking at it at the same time. You could also share your screen if you needed to, but it's probably best for them to have it right in front of them. As I said, you may not always agree on the issue, so just think before you react. And if you aren't really kind of agreeing on things, you still want to make your point in a rational way, because it may make a difference to that legislator. And if you handle yourself well, you all build a rapport, you start building that trust. And then in the future, you have that bridge already there for you to be able to work with that legislator and remind that person that you're there as a resource for them. I know you know to always say thank you, but more importantly, follow that up with an email thanking them for meeting with you and summarizing what your points were. So I wanted to give an example because there was a meeting that just went so perfectly that it is a great example of how you want to meet with a legislator. So there was a group that determined that they wanted to meet with a key legislator on child and family issues. They chose a limited number of people so as to not overwhelm the legislator, not 20 people showing up in their office, but 3 people showed up in their office. That works, 3 people. You decide what your message is, and in this particular case, that message was to offer themselves as a resource. It was a starting point with the legislator. I get to know you and what we can do and how we can work together. So one of the people contacts the legislative aide for that legislator and sets up that meeting. And then the group representatives decide on what materials they want to bring to that legislator. And it may be examples of newsletters or a legislative priorities list that you have. And then always that contact information that would be included with your website or phone numbers or whatever contact information you want to provide. And then you can kind of set out a tentative or just sort of a loose agenda on what you want to do, remembering that you probably only have about 15 minutes to make your points. You kind of decide who wants to make those points, who wants to take the lead on it. It doesn't mean that other people can't say things, but you want to be sure that your points are made. So if you assign them to people, then you're more sure that you're going to get to those points. So on the day that you're meeting with that legislator, and in this particular case, they were meeting with the legislator in her office in Raleigh, the group representatives meet at a designated location outside of the legislator's office. So you're kind of organizing yourselves, and then you go to the legislator's office together and you check in. And the legislative aide escorts you into the legislator's office when they are ready. And you begin with your introductions, and you may even begin with introductions that kind of make a connection to the legislator so that they are really kind of aware of why you're there and how you connect with them. And so then you begin to make your points, because once again, you may only have about 15 minutes to do that. You move into your main point when you can. You offer yourself as a resource in the particular example that I'm giving you. So the reason that this example was so perfect was because that legislator then recounted a recent call that she had gotten from a constituent parent, and she didn't know exactly how to respond to it. But it happened that one of the people who was in the group that met with that legislator was the perfect contact person and the perfect resource to help her kind of connect with that parent and get that parent help. And we were able to offer that. But it doesn't have to be somebody who's actually there. If you know the name of the person, you can give that legislator the name of that person and the contact information. So it went really well. You had the opportunity to make your point. You had the opportunity to serve as a resource. So there's an example of what you can do in the future. And so you're done, and you can say kudos. You did a great job. So now I want to switch gears a little bit and talk about state policy making. And that is different from legislation, as you can imagine. Once legislation is done, then to get the details on what we're going to do to implement that legislation, we create rules in the state. And the rules are overseen by the Office of Administrative Hearings, OAH. There are rules through the North Carolina Department of Health and Human Services. They have the NC Commission on MHDD SAS, and they do a lot of the community-based and state facility rules. They have the Physician Advisory Group. For education, the State Board of Education oversees the rules process. And then for the Department of Public Safety, it's secretarial rules. And I'll say too that the DHHS secretary is also able to promulgate her own rules. And rules then again have that detail that show you how they're going to implement legislation that was passed. For Medicaid, because it's predominantly federally funded, they have something a little bit different called clinical coverage policies. And those tell you service definitions, they tell you the types of professionals that can provide services, the duration of units of service, that type of thing. Right now, the department is seeking feedback on telehealth clinical coverage policies, because during the pandemic, we absolutely ramped up our use of telehealth in the state. And now we're kind of leveling it out and figuring out what do we want to be permanent about telehealth. So they're seeking feedback right now on that. We also have policy initiatives, and sometimes, and particularly for the Department of Health and Human Services, that means that they may have concept papers. And that's happened a lot in Medicaid transformation. They'll develop a concept paper on one of those components of their vision of Medicaid managed care, and they're asking for feedback on that. And they get a lot of feedback from professionals. But what I'm hoping is that they're going to get a lot of feedback also from families and from individuals, consumers in the system, and advocates too, because that perspective is so important to make it really meaningful and successful in implementation. I wanted to give you one resource. If you go on the General Assembly website, they have a link to the North Carolina statutes and all the rules that are related to those statutes. And for MHIDD SUD services, we look at Chapter 122C. So there are just a ton of ways that you can get involved at both the state level and the local level. You can serve on committees and work groups. You can put yourself on mailing lists. The legislative committees each have subscriptions, and then they will email you when they have meetings coming up or if they have changes in those meetings. And that kind of gives you an idea of what they're considering. During the legislative session, it'll have a list of the bills that they're going to be considering at that meeting. It's a free subscription. You can also do a notification subscription through OAH for rules. They don't narrow it down. It's going to be all the rules, but it's really not overwhelming. It's very easy to get through if you want to keep up on rules changes. You can find go-to resources for updates and information like websites. Websites of the sponsors of this Advocacy Institute would be a good start. And what I've noticed in the pandemic is a rise in free opportunities like webinars. And sometimes I think, are they really looking for someone like me to be on this webinar? But it says it's free. So I register and I listen to it and I find out more information. I learn things. And I'm sure that you all are seeing those free opportunities too. And I would encourage you to take advantage of them. So just imagine that the youth and family voice is always a part of the legislative and policy making. How that would make our system so strong for your voice to be heard and to be known at the front end when we're doing legislation and when we're doing policy, so that as things are carried out and they get to the local level, they're meaningful to you and they're right for you. That would be powerful, and that is not my arm. The most important thing that I want to encourage you to do right now as an advocate is to vote. The NC Child has a campaign going on, #VoteForNCKids, where you can pledge to vote for kids. And that would be one way that you can advocate during this voting season. And of course, the most important way is for you to cast your votes. As I mentioned before, the 6 agencies that are supporting this Advocacy Institute are a great place to start for resources. This is a link. When you get this PowerPoint, you'll have a link right to them. For the Eye to Eye Center, we do a newsletter, and we also do special alerts when things happen in between newsletters. We have trainings, and I know all of these organizations have that available to you. And I finally just wanted to give you my contact information, my email and my phone number. So if you have anything that you want to talk to me about advocacy in the future or contact me for, I would welcome that. And that is the end of my presentation. And I want to say thank you so much for listening. And I wish you the best of luck in all of your advocacy.
Excellent. Thank you, Ann. That was incredible. Thank you. Every time I'm watching all of these Advocacy 101 presentations, and I'm learning something new every time. So I really, really do appreciate it. And I just want to kind of lift up sharing your story and how important that is in this work, that sharing your personal experience or the experience of your family is so important, and that your example that you walked through with meeting was so helpful, because I know that can feel intimidating. It can make you feel nervous. You're not sure what to expect. So walking us through that was very helpful. So thank you.
Thank you. Well, I'm really looking forward to hearing about some advocacy success stories from people.
Me too. So we're going to take a quick break until 10:20. So we're going to take just a few minutes, 7-minute break, 8-minute break. So, and then when we come back, Stacey Justice, our Parent Voice keynote, will be sharing with us, and then we will have our legislative panel discussion. All right. Thank you, Ann.
Thank you.
Thanks, Ann.
Thanks, Adam.
Mhm.
Sorry, got the music going. All right, welcome back, everyone. Now I'm going to turn it over to Adam so he can welcome our Parent Voice keynote.
Thanks so much, Malia. I appreciate that. And hey, everybody. Again, this is Adam Sotak. I'm the Public Engagement Director with NC Child. And I have the pleasure right now of introducing another one of our keynote speakers, our parent speaker today, who is Stacy Justice. And I know many of you all know Stacy and her good work. Her good reputation precedes her. And I first met Stacy, I believe, when she was working with East Point, and now she's the Associate Director for North Carolina Families United. And she's a passionate advocate as a professional and, most importantly, as a mother and a grandmother. And she lives in Eastern North Carolina, in Wayne County, I believe. And I've had the pleasure of working with Stacy for many years now in her role as a leader in the North Carolina Collaborative for Children, Youth, and Families. And so I'm just really excited to sit back and listen to Stacy talk some about her perspective as an advocate. Thanks, Stacy.
Thank you, Adam. Thank you, Adam and Malia. So, as Adam said, I am Stacy Justice, and I am the Associate Director in North Carolina Families United. I wear multiple hats. I'm also co-chair of work group, a policy and research work group for the state collaborative, and I am a parent of, as Adam said, 4 wonderful children and 5 grandchildren who keep me all very busy in the reasons I do the cross-system work that I do. As we have heard throughout the presentations today, that families and individuals with lived experience have a huge impact on changing policies and services. Today, as I go through this presentation, I'm going to talk about families, but just keep in mind, it is this that I'm going to talk about can translate to any lived experience individual, such as a youth or consumer peer support. Let me see if my slides advance here. So the families of today. Families of today are big, small, they're extending, they're nuclear, they're multi-generational, one parent, two parents, or they're maybe just grandparents. They live underneath one roof or many roofs. Family could be temporary for just a few weeks or permanent as forever. We become part of a family at birth by adoption or by marriage or from a desire for mutual support. And as family members, we nurture, protect, and influence each other. Families are dynamic and have cultures all unto themselves, different values and different dreams. Together, our families become the source of our rich cultural heritage and spiritual diversity. Each family has strengths and qualities that flow from individual members and from the family as a unit. And our families create neighborhoods, communities, and streets, states, and nations. So before I go into the context of what I'm going to talk about, I wanted you guys to keep in mind that families do not know what they do not know. That each family is a new book. Every family is different. And not everything works for everyone. And that for over 30 years, research has shown that families prefer to learn from one another and they trust one another. So what is a way that we can start addressing the barriers identified today by Deputy Director Cody Kinsley? This can be done through family professional partnerships. Research has shown that family and youth participation and partnership and leadership are the most effective factors in positive outcomes for children and youth. This has also been consistent in cross-systems research. And therefore have been required by some of the fundings and funders of grants that families and youth and individuals with lived experience be involved. So what is family professional collaboration? It promotes relationship in which a family and youth and professionals work together to ensure the best services for that child and family. It recognizes and respects the knowledge, skills, and experience that families, youth, and professionals each bring to that relationship. And it acknowledges that the development of trust is an integral part of that collaborative relationship. It also facilitates open communication so families, youth, and professionals feel free to express themselves. And it creates an atmosphere in which cultural traditions, values, and diversity of families are acknowledged and honored. It recognizes that negotiation is essential, and it includes acknowledgement of mutual respect for each other's cultures, values, and traditions. So how do we start to build these or continue to build these family and professional partnerships within our communities, agencies, or organizations? It can be done through a variety of ways. One of them is by establishing family-driven practices. And family-driven means families having a primary decision-making role in the care of their own children, as well as the policies and procedures governing the care for all children in their community, state, tribe, territory, or nation. So this family-driven includes choosing support services and providers, setting goals, designing and implementing programs, monitoring outcomes, and participating in funding decisions and determining the effectiveness of those support services and providers. Another way is through family involvement, and that is that families receiving services are supported, prepared, and offered the opportunity to participate as full partners at all levels, especially in the planning, implementation, and evaluation of programs and services and their related policies and practices. Family involvement is that families are involved in decision making and are more satisfied with their primary care provider or their agency or organization that they're receiving services through. And families active in developing their plan of care are most likely to follow and maintain that plan of care and engage in services. Another way is family engagement. Encourage families to be involved in their child services, in their services, and with other families, ensuring opportunities for involvement. So some of the engagement basics are: families must be present, prepared, and supported. And success depends on adherence to protocols and attention to training and coaching. Efforts to identify and engage supports must be continuous and aimed at expanding team capacity, and regular meetings are important in interim follow-up of that for engagement. So why do we need family involvement besides what the other presenters spoke today? Parents facilitate the interaction between the child and the service system, and as such represent the central dimension of that system of care. And when children are the recipients of mental health services, primary caregivers are often responsible for making decisions that support their child's recovery. Family involvement is a key element of a child's success, especially for children in residential treatment. Some benefit of examples of having family voice or lived experience of voice is that families and youth are driven by experience and a passion. Families and youth often trust one another more than they trust the system. Families and youth engage in clinical services quicker in complete treatment. Involvement gives families and youth a sense of ownership and a shared desire to make the program successful. Partners are easier to work with than adversaries, and family and youth involvement reduces the demand on staff. Families and youth serve as a reality check for the program, and families and youth can validate the differential between perceived and real needs. Diverse families and youth bring new perspectives to the table. Families and youth can help sensitize agencies and organizations, and families can advocate in ways that professionals can't. So remember, families, parents, and individuals with lived experience are the experts. Whether their experience is good or bad, they can assist you in shaping the policies and service delivery systems to be more responsive to the individuals that you serve. North Carolina is unique in that we are rich in family and youth-driven groups and initiatives. These include the North Carolina Families United, Youth Move North Carolina, and Say So. North Carolina has the State Collaborative for Children, Youth, and Families, and the collaborative has cross-system members from Child Welfare, Juvenile Justice, Department of Public Education, Child Abuse Prevention Services, ARC, NAMI, Youth Move, North Carolina Families United, and other groups dedicated to better outcomes for children and families. I wanted to put this up here as this is some of the resources. You can find the State Collaborative, the Family and Youth Center of Excellence, and North Carolina Families United, and North Carolina Youth Move. You can locate resources and information and find out more about what their mission and visions are. Family peer support, we have access to family peer support here in North Carolina, and these are just, I'm not going to go through these as I'm running into the panel time. I want you guys to be able to hear from the legislators, but these are some of the lived experience positions that you have access to here in North Carolina to help you provide, shaping your programs and provide that lived experience voice in service delivery. And this is also, we also have access to consumer peer support and youth peer support. So on a bigger scale, wrapping up, take charge, develop and implement a way to work. Create a model that carries a message of partnership and acceptance, and integrate family involvement throughout the delivery system. Utilize creative practices and develop a strategic plan for family or lived experience involvement, and establish an out-of-the-box practice that will engage families and assure authentic family involvement. And remember, authentic. As I close out, I want to leave you with this. The memories of your time and effort spent with a family will be etched forever in their book of life. In the end, and only in the end, can we see the connection between these interactions and the effect they had on future events faced by different family members. Each encounter with a family, no matter what their situation nor for what duration of time, should be seen as an opportunity to change the course of eternity. This family and their children and their children's children and each generation after could be impacted in some way by your presence. With the endless boundaries of this possibility, there is little time. And that is it. I thank you guys so much.
Stacy, thank you so much. Really appreciate your perspective and all that great information you shared. I mean, as we know, just family and community engagement is just essential in making these systems work and making advocacy possible and ultimately improving the lives of children and families in our community. So thanks so much for sharing that. And I know that's helpful information that we will be able to share with people after this as well.
Thank you.
So, yeah, absolutely. Thank you. And now we will be moving on to our panel, our legislative panel, and I'm going to let Malia work her magic to get the honorables onto our screen, hopefully.
Yes, you both, Representative White and Senator Davis, you both should be able to turn on your cameras and unmute yourselves. Hi.
Hi, Representative White.
Hi, how are you?
Doing well. I hope you are. Let's see if we can have Senator Davis join us here.
Should be able to turn on and unmute. Let me see. Nope. He is here.
Okay, well, let's
All right.
maybe give him a few more seconds and then we can move forward with an introduction of Representative White and hopefully the senator can join us, perhaps.
Oh, there we go.
Can you hear me okay?
We can, yes.
Okay, I have audio, I just don't see a video connection.
Let me see here. There's a little camera that's next to your name, if you can see it in the panel.
Here. Hold on one moment. If you would wish to go ahead with the representative, and I'll see if we can figure out where the camera is.
All right, wonderful. And we know we've at least got you on audio, Senator Davis. So,
all right.
Yes. So again, everyone, welcome to this very important and we're very excited by this legislative panel. Again, my name is Adam Sotak. I'm the Public Engagement Director with NC Child. And I really want to thank Representative Donna White for being with us today and Senator Don Davis. We know that your schedules are incredibly busy. You have a whole lot going on, but your perspectives as leaders around health issues in the North Carolina General Assembly and in Eastern North Carolina are incredibly important to the 150 people who are on this webinar right now, as well as many others. And I know that we're really all going to benefit from your perspective. So just for a little more background, everyone, Representative Donna White is in the North Carolina House of Representatives, District 26 from Johnston County. And she is a registered nurse. I believe spent your career as a public health nurse mainly, Representative White?
That's correct.
Yeah. All right. So, you know, she brings that perspective to the table as well as other experiences. And Representative White is a member of the Health Committee in the North Carolina House and many other important committees. And she's really, even in her second term, quickly become a go-to voice, I know, for many of us advocates when we're looking at the health of children and families. So, again, we really appreciate you being with us, Representative White. Senator Don Davis is a senator who hails from Greene County and represents Greene and Pitt County in the North Carolina Senate, Senate District 5. And Senator Davis has been in the legislature for 5 terms now. And he is a member on the Senate side of the Health Committee and has been actively engaged in health issues for children and families for many years, and will continue to be so, I'm sure. And so, Senator Davis, we also very much appreciate you being with us today.
No, it's truly a pleasure to be with you. I wish I could turn my video around, but I don't see a function, but I definitely see audio.
I wish you could too, Senator Davis. It would give me encouragement.
Well, you're always encouraging, Representative.
I like to have my chair around.
Well, thank you all again. And we have just a series of questions that we wanted to ask that are health related, as you might imagine, and really looking forward to getting your perspectives. And then near the end of our time, we wanted to allow each of you just a few minutes, if you'd like to take it, to just talk about anything else that you feel like is important to mention or discuss. So I wanted to just start out and throw a softball out there, as they might say, and just say, how have you been taking care of yourself and your family during the pandemic? Representative White.
Thank you so much, Adam, for asking that thoughtful question. And I wish that I could say that I had been a good nurse to myself. Unfortunately, March through June or half of July, I was working about 22 hours a day due to the pandemic and the unemployment issues, and trying to get the bills out in the timely manner so that we could appropriate funding to all the different folks across North Carolina that needed it. So it was a really huge job, and I try to answer every one of my emails personally, and I answer every phone call personally. And so it was causing me to work 22 hours a day. And I am not joking. But I began to realize that, I just couldn't keep doing that. Even if I had been 16, I couldn't do that. So I have been putting about, 16 to 20 hours a day in now. But that has helped a little bit. And I went yesterday I had not had a physical in a while, so I thought maybe I better do that. And so things were good, and that made me feel like that all the work was certainly beneficial for the folks in North Carolina, and an honor to be able to serve in the capacity of a nurse. And so the good thing is that my children are grown, and my grandchildren, as long as I take them to the arcade once a week and let them ride the Himalaya, and we play air hockey, they are fine. So, that's kept me happy too, be able to do that.
Yeah, well, thank you. I hope you take care of yourself. Glad that physical seemed okay.
Yes.
Senator Davis. Senator Davis.
Yes, I'm with you here. Okay. It froze my screen. Okay, my screen froze for a moment, but I was listening to Representative White, and for a moment I was just having so many flashbacks based on all the efforts that took place across I think all spectrums to roll out a COVID package that would work for our families across the state. Obviously, it didn't go 100% as far as we would like, and we're still obviously optimistic that there could possibly still be some federal funds, but nevertheless, with those funds that came, it required a lot of balancing, trying to stretch those out, and it just took extra effort. Let me say this. Thank you so much for the question, and I really hope that everybody that's out there today, that they are safe, their families are safe. And I can definitely tell you, Adam, I have 3 kids, and we've been, trying to balance, their situation, especially when the COVID-19 pandemic first kicked off, and in terms of, just balancing our lives, obviously all of us right now have been shaken a little bit and maybe are not in the same routine that we were before, and we're trying to figure all of this out. But I really hope in the midst of all of this that everyone knows, as Representative White indicated, that we're working hard, to do everything we can to help our families, to go, as far as we can with that assistance. At the same time, we're balancing our own families, our own households, and we're all out of our normal routines, which is evident. We're here on this call today and do a video conference. And I must admit this, in the midst of it all, Adam, I want to really put this out. I'm just a people person, and I miss seeing as many people these days. So thank you so much for the question.
Yeah, I understand. I know it's hard in so many ways, but we're going to get through it together.
Yes.
Malia, would you like to?
All right. And I know, Senator Davis, you're trying to see, I want to just one more time see if you see a little camera next to your name in the panel. If you click on that.
I clicked the link that brought me in. The only thing I see is the microphone. I am typically broadly familiar, but I only see the microphone for whatever reason.
I apologize. I'm so sorry. And unfortunately, I can't control turning on your camera, which is probably a good thing, that we can't control that, right? But also, unfortunately, I can't help you. So I hope that it does come up, but I'm glad that you're here with us today.
Malia,
yes.
I don't know if this would help, but I had 2 or 3 options for using the camera, and one of them is just like a little, it's like a little linear ticket thing, and it's got the microphone, and then it's got the camera underneath that. But then to the right of that, where it says webcam, there's another camera, so you can use that one as well. I usually have an option at the bottom, but this one didn't offer that. So, but that was 2 different options. I don't know if that would help or not.
There might be, I don't know if you're able to see that there's one up at the top of the screen and then one right next to your name, a little camera, if you can see that.
Right. Well, I'll tell you what we can do is, if you want to proceed, and I can hop out and even try to come back in really quick and see if I have any more options there, and we can proceed with Representative White, maybe on the first question or so.
Don't leave.
Okay,
Stay home.
I'm not leaving. I'm coming right back. I'm see if I can it'll work.
All right. So we'll go ahead then and start with the first question while he signs out and comes back. So Representative White, we're going to start out talking about schools, something that's on so many of our minds. I'm a parent. Many of us are with young children in schools. We did receive quite a few questions about schools when we were asking people to submit questions. So the first question is, school-based mental health services can provide convenient access to mental health services that some students may not otherwise have. However, they are also inaccessible to students who are not attending school due to refusal, transportation barriers, physical illness, mental health issues, and/or other issues. What solutions are being explored in order to ensure that all students who need school-based mental health services are able to access them, including those students who are struggling to attend?
Thank you so much for the question, Malia. And obviously, so what I'm going to do is kind of share some things that we've already done, and then I'm certainly open to suggestions about what we can do moving forward. I just want to mention, first of all, that for the last, since 2013, well, first of all, I was a school board member for 12 years before I came to the House, so obviously school is important to me. And in 2013, I was appointed to the first Safer Schools Task Force when it was first formed as the only school board member in the state. And then in 2016, when Governor Cooper had just been elected before he was inaugurated, or sworn in. He reappointed me because my 3-year term was up at their 3-year terms. And so he reappointed me in 2016. And I am still serving on the, and at that time I had just become the legislator. So I was the only legislator on the Safer Schools Task Force. Now, as you know, because of Parkland, we also had the House Select Committee on Safer Schools, and I was a member of that as well. But I just say that to say that last week I was on a conference call with the Safer Schools Task Force. It's our monthly, or every 2 months meeting. And, you know, they're now housed in DPI. They were housed in DPS. But we have, this will be coming out very soon. It's a collaborative, so a Safer Schools website that will be showing all of the initiatives and plans moving forward. And this is developed with the State Board of Education, the Safer Schools Task Force, the Safer Schools DPI, DPS, and actually our chairman of our Safer Schools Task Force now is William Lassiter, who is with DPS with the youth program. And so we've done phenomenal things with the Second Chance Act. We've done phenomenal things with the Raise the Age. And I believe that those are not, it's not specifically related to the children that are in school right now, but it will be as they get a little older. So hopefully, and actually raising the age is going to even affect kids that could be juniors or seniors in high school right now. So those are 2 significant things that we've done. But I've tried to get up with Billy to find out, sorry, William, I always call him Billy. I tried to get up with him because the Safer Schools website is not supposed to, it was supposed to be released this week. So I'm not sure that it got out there. I couldn't find it, but I didn't have the complete address. So I'm not sure if it was out there. And I called him last night, but I wasn't able to get up with him. So anyway, but be on the lookout for that because it will be a significant resource for people. The other thing, as you know, I probably, or maybe you don't know, I have a bill that's still sitting in the Senate, and that's why I wanted Senator Davis to be on, so he would hear my plea. It's still in the Senate rules, but it again addresses more mental health services and school nurse services and counselor services. We did put during the COVID initiative, that especially the first program, we put in $10 million for school health support, which was it gave local systems the opportunity to choose to choose more counselors, more social workers, and more nurses. And typically they chose more counselors and social workers because school was not in-person session. So the nurses were not as able to help with the children. So anyway, we also tried to get a telehealth bill through, and it passed out of the House, and I worked on it until the very last minute of the very last session. And unfortunately, it got hung up in a conference committee, and it did not make it to the full vote. But if I am fortunate enough to come back in January, that will probably be one of my first bills out the door, is because I think telehealth at this point, not only for physical health, but for mental health. I don't personally, as a nurse, I don't think that mental health is I don't think that telehealth is the best tool for mental health, but I think it's a tool for protection and for a quick assessment so that you can know if you need to go further. But I think sometimes in physical health, you can deal with the issue, but mental health is a little bit different in that it's a little bit harder to diagnose when you're not actually seeing all the body language and assessing the person as a whole person. So those are some things that we've done. Also, I just want to mention the Child Wellbeing Transformation Council, which, I've served on as we have 2 representatives, Sarah Stevens and myself, and Senator Krovic. And, you know, this was, it was mandated from the Rhines Law, and as a result of the Family First Act, that we are under a federal mandate to address issues related to CPS, Child Protective Services, and especially the foster care reform. So, and I know that we're not talking particularly about foster children, but many of the children that we are talking about today will become foster children if we don't have stronger support and stronger sustainable services. So I just wanted to mention that with the Child Wellbeing Transformation Council, we have finished our report. It came out in August, and it's now kind of in the lab, and I don't mean that disrespectfully, but it's at DHHS now to start, looking at that implementation. And we do have a bill, and I'm not really sure exactly how the process is going right now because we've been so focused on COVID that we haven't been able to follow through some of the processes about where things are. So I don't want to say anything. If I say anything, that I just say that it's there, and because it has been a federal mandate and because it now is in place, the hope for that is that we would have response back by the spring of 2021. But there's about there's a good number of recommendations that will strengthen, give more resources, and collaborate better between all the systems that deal with children who or end up in the foster program. But one of the things is that we had a bill analysis did this. It would be part of the bill that would be going forward. It directs the Department of Health and Human Services Division of Health Benefits to develop and implement a plan to work with DPS, DPI, and local education administrative units, local management entities, our LME MCOs, to ensure increased awareness of school-based health services that are reimbursable under the North Carolina Medicaid state plan and beyond individual education program services. The plan shall include an assessment of the feasibility of enhanced rates and other mechanisms that encourage private agencies to provide these services to eligible students. DHP shall submit the plan and any recommended legislation changes to the Joint Legislative Committee, and that's supposed to be done by August 1st, 2021. But again, those dates are, don't think about the dates, because depending on how things move forward, and we know that COVID has kind of changed everything, but that is the plan. So I'm very excited about that, and I am very excited about let me just share a little bit about some of the funding that has gone forth. I mentioned the 10 million. We also, for public schools, their budget has been held completely harmless, meaning that the budget that they had for the last biennium is still their budget for this biennium. And budgets in the local school, local LEAs, the local education authorities, are based on a certain day in September. After they've been in schools a certain number of days, and that day tells you how many gets the ADM, or the average daily membership, and that determines how the public school is going to be funded for the rest of that year and for the next, during that fiscal budget year. So the school system has lost, public school system has lost about 20% of their students for various reasons, all pretty much related to COVID. And therefore, we felt like it was important to hold them harmless so they could still provide the services and not have to cut employees or wages, or and not be able to provide those supplemental services like we're talking about today. So those services are still in place because we voted in September to hold the public schools harmless in terms of their budget. So I just wanted to make sure everybody realized that these additional monies that I'm talking about are in addition to the regular budget. In the first act, we gave over $685 million to Health and Human Services, and basically a lot of that was for school support. I got over 8 million, 4.3 million in the first CARES Act for foster facilities and foster homes, so that each child would get an extra $100 a month to help out with anything related to COVID. Then we knew that lasted for 3 months, and when we came back in September, we extended it so that it would last until the end of December. And of course, I keep mentioning foster, but I do know, because I've worked in the program my whole entire life pretty much, that the children we're talking about today will either be foster children or have been foster children. So I think it's important for us to continue to strengthen that foster care program.
Also, Representative White, I do want to give the senator an opportunity to answer as well.
I'm sorry, I didn't know how many seconds I had or minutes, and I wasn't looking at the clock. Please forgive me.
No, you are fine. You're fine. You're sharing so much good information, but I do want to give the senator an opportunity to respond as well. And Senator Davis, I'm going to repeat the question for you because I know you had logged out whenever I read over the question. So we're going to be talking about schools right now. School-based mental health services can provide convenient access to mental health services that some students may not otherwise have. However, they are also inaccessible to students who are not attending school due to school refusal, transportation barriers, physical illness, mental health issues, and/or other issues. What solutions are being explored in order to ensure that all students who need school-based mental health services are able to access them, including those students who are struggling to attend school?
Okay, thank you so much for the question there. And actually, I thought Representative White was doing a great job. I was glad to just continue listening because in all truthfulness, she was highlighting a lot of good work that I believe is taking place in the General Assembly. One thing that I would first add to that list is, and I'm not sure if I missed it or not, but we worked to push a bill through, and it's come now after years worth of work to address the suicide prevention and helping to get into our schools efforts to identify much earlier. And even though it was titled suicide, it got into some mental health components, bullying components, and there are other parts of that legislation. And I believe that was huge. I believe it will be proved to be very beneficial for children. Now, getting back, I believe at the root of the question, and I believe Representative White hit on something in particular that might be very beneficial. What I'm understanding the question in terms of access, we know we have something good that's taking place in our school systems, and for all of those who are doing the work day in and day out, we greatly appreciate them for providing those services in our schools. But what we understand then, I think at the root of the question, some kids, even though we have something good in the school, are not accessing those for whatever reason. And in some capacities, you have different barriers, different things that that's getting in the way, and part of that, you have students that can't even make it to the school nevertheless, as we're dealing with the state of the this public health situation. So Representative White hit on this, and I think this is huge, and I think this has been a big eye opener for all of us. How do we continue to integrate technology in a way to provide services, even during a state of emergency, so to speak, whether it's now COVID-19, whether in Eastern North Carolina we deal with a lot of hurricanes and tornadoes that eventually send kids home for lengthy periods of time. As we're restoring power and all kind of things. But one thing that stands out here is telehealth. I think there's a real opportunity here because, again, it's about making the connection. How do we connect even a student that's not in the schoolhouse with the schoolhouse, with the services? And something that was just really amazing to me when we then talk about telehealth is also just broad awareness. Even though all schools return for in-person learning, there's a lot of virtual applications that's taking place. Students are using Zoom, Canvas, different platforms. But one thing that stood out to me, my wife is an administrator, an early childhood administrator, and one of the staff members, they were going into the virtual classrooms to make sure that all the students were aware of the services that were still being offered during that time. Right now, part of this challenge for some is just nevertheless getting academic information out, but also I think sharing how services are still being provided. I do believe that's something that is essential as well, even in a virtual setting. The other thing I would add to this question, which for me is a much broader step back and looking at some broader implications when we think about transportation barriers, when we think about infrastructure barriers. I think about the broadband, and one of the things that I thought was huge is during the COVID situation when we were working on the recovery package, is we actually went over to the Department of Information Technology, and within the department they have what's called the GREAT grants, and these are grants specifically tailored for rural communities for getting broadband out into these communities. And long story short, at the time they had about around 10 million applications, applications valued at about $10 million. And long story short, I really believe the General Assembly, we were very gracious. We funded all those projects as well as waived the grant application deadlines so that we could specifically, hear this, help to get broadband infrastructure out in these rural, and these are the rural communities. So I believe that's huge. Again, if you can't get them necessarily in the schoolhouse, how do we still make the connections? And obviously, there are broader issues that we still have to tackle to keep kids in the schoolhouse. So thank you so much for the question.
Thank you very much. Adam?
Yeah. Thank you both for those those great answers, because they're very informative and they let people know about what is available and the good hard work that you all have been doing together. And that's something we've gotten a lot of responses from these policy institutes so far. I'll just be honest, where people say, it is so refreshing to hear our elected leaders just talking about some of the commonalities and ways that we're working together and things that we're getting done together. Like that GREAT program. I know that was a bipartisan effort, and it's something that benefits all our rural communities and our communities across the state. And a lot of things happen like that, however, maybe we don't tend to hear about those things as much. But so just moving on to the next question here, and this is about access to health care. And I know this is something that you both have been involved in and care deeply about. And the bottom line is that hundreds of thousands of our North Carolina families, many parents and others, have lost their health insurance that they previously may have had due to the economic impacts of COVID-19. And we know that even before that, there was quite a few people that lack health insurance coverage. What is your plan to get affordable health coverage to more parents, more people here in North Carolina? Representative White?
Senator Davis should go first on this one. Senator Davis and I joke a lot together. So
yeah, this is my partner, my buddy. I'm glad to jump in on this one. This is what we know when we think and look specifically in Eastern North Carolina. There was a health crisis, so to speak, taking place before the pandemic. And the pandemic only places a magnifying glass on what was now already taking place in Eastern North Carolina. We have one of the highest populations of underinsured. We have a high population of uninsured. And long story short, we understand, and I really believe it's way more bipartisan than what we led on to believe in terms of doing something that fits North Carolina. I just kind of got to the point, I would love to see us close the coverage gap. I believe that would take us a long ways. I do want everyone to realize this when we say close the coverage gap, the access gap, Medicaid expansion. I mean, people say it in different ways. It's not just a simple policy decision, and you know, I do believe there should be a fit for North Carolina, and I'm saying it from that perspective. Um, we can get to this. We can get to something that will work for us. And I'm willing to work to roll up my sleeves with whoever we need to get it done. At the end of the day, I believe the House, you know, there was the Carolina Cares, and it was Carolina Cares kind of 2.0. There was some early movement in the House committee, and the representative can tell you way more about that. It never made it to the floor, I don't recall, and it definitely didn't make it to the Senate. Um, you know, we need something that we can agree on, and I'm going to start out by saying this. This is often where I've tried to work, and that is when we're dealing with policy and we're trying to come to some sort of agreement. We have to realize that no one's going to walk away at the end of the day with 100% of everything they want. But this is an issue that the public is really screaming out right now, that, and I hear from Democrats, Republicans alike on this. My chamber has been very supportive of us moving towards a North Carolina solution. There are people at the end of the day, and especially in our rural communities, who are being left behind. I think about our hospital system, our overall delivery of care, the implications, whether it's mental health, whether it's opioids, whether it's the impact on veterans. There's just so many impacts. And when I think about, for instance, Vidant Health, is at the center of a 29 county healthcare network, and they write off about $200 million worth of unpaid bills every year. This is the population that's being served in Eastern North Carolina. If someone doesn't have insurance, they show up, they're going to be treated. We have to come up with a model that works. And at the end of the day, it will, I believe, expand access for all families, or most families. We can definitely and should move in that direction. So I just think coming out of this election, hopefully there's some sort of appetite to move forward in the state of North Carolina.
Thank you, Senator Davis. Representative White.
Thank you. And Senator Davis certainly said it well. And let me just tell you all that Senator Davis and I are a part of a newly formed Eastern North Carolina Regional Caucus, so that we can meet during the legislative session and non-session to address issues specific to Eastern North Carolina, because both of us represent counties that are in the 41 Eastern North Carolina counties. And Senator Davis is the chair, and I am serving as the vice chair. It is a bipartisan committee, and bicameral with both House and Senate. And I do want to give a shout out to former Representative Farmer Butterfield, because it was her idea. And so Senator Davis and I were asked to participate. And before we knew it, we were officers because she left. So we really do have skin in this game. But I do want to just mention, and I know that many of our listeners may not know this. I always just like to let you know what we're already doing and then talk about what we need to do. First of all, with COVID money that will be through end of December, we gave $12.5 million to the free and charitable clinics, which are, a lot of those are in the far east, far west. We gave another $12.5 million to the community health centers, and gave another, I think we divided that into 600 million each. Anyway, or 600,000 each. We also deregulated, and I'm very proud of this because we've worked really hard. It's called the SAVE Act. We couldn't get the SAVE Act as a whole passed, but what we did with COVID policy, not so much funding, but policy, we allowed PAs and nurse practitioners now to function without having to do that quarterly review with a preceptor that might be hundreds of miles away. And so that is going to that is reducing their time so that they can see more patients actually in their clinics. And so I thought that was a really big coup, and that will go on actually till December 21. So so we're very happy about that. And also we did that for midwives as well. So we also I was able to get a bill put in, or portion of the COVID bill in September. We were actually able to get the Board of Nursing to be allowed to allow student nurses who could not get through all the clinical, but they had passed everything. Essentially, they just needed to have that sign off, and because of COVID, couldn't do that. But they're practicing under a temporary license, and also we allowed all retired nurses and nurses that were inactive to go back and to just reactivate themselves if they didn't have any issues related to their current, their former practice, and that way it increased our healthcare, our frontline workers. So I thought that was a really big coup as well. Sometimes it's not always money. Sometimes it's trying to put policy in place that really puts people where they need to be, and to help more people, because we knew that more people that were uninsured, underinsured or uninsured were going to be coming into those facilities, and we needed more healthcare providers. I do want to mention too that I'm very honored that when I first came to the legislature in 2017, that I was asked to be a participant in what Senator Davis referenced as the Care for Carolinas, and that's what we call the bill for working families in the first 2 years that I was there. In 19, we re-entered the bill, and pretty much it was the same bill, but we now call it Insurance for Working Families. We felt like that would be more understandable than Care for Carolinas. Carolina Cares, I'm sorry. Care for Carolinas is an organization. Carolina Care that has promoted us, and we appreciate that very much. The Carolina Cares was the name of our first bill, and the second bill was Insurance for Working Families. And this would have increased 700,000 insurance for 700,000 people, because a family of 4 making 32,000 would be able to get an insurance policy that would cover them completely and their whole family of 4 for $800 a year. And so we felt like that was that does 2 things. As a public health nurse, I've learned over time working with family. I've worked with marginal communities my whole nursing career. So what I have learned is that when people take an interest in doing something to help themselves, even if it's just if they can take a baby step, that baby step sometimes will help them not only accept the appropriation for the insurance, but it will also, or anything else, but it will also help them to be prideful and to be interested in keeping that. So as a public health nurse, I said, well, I will come on the bill if you will let me say that they have to have an annual physical, and they have to have age and gender appropriate screenings that are paid for by the insurance. So it's not, and as long as they do that, they can stay on the bill. So we did have another state that a federal judge came in and got involved, and if we could do away with the court system for a while and just let people let us pass the laws, I think that would be good, and I won't go there right now. But anyway, I think it's still doable, and I think that that would be a really great asset, and I'm sure now that there would be more than 700,000, but then 19, that was our number that we were focusing on. So I'm very glad to still be a big participant of that. So yes, we do need to have affordable and accessible, and I think that I do want to mention too, during COVID, people that were unemployed that were eligible for unemployment benefits for a time were getting about $900 a week, which for some of them, 3 times what they may have gotten if they were working. So, you have to understand that if they had an affordable policy that they could have paid for $800 a year for a family of 4, I mean, they wouldn't be having a problem at all right now. So I think we have to point that out. And also, holding the education system harmless. All of our education employees, still have their salary, and state employees as well. That helps us hopefully to be able to really focus on it. So I have a question for everyone. I'd like for people to send me text or emails or whatever. I'm very, very approachable and available. So if you'll just send me numbers of people that you know in your community that are totally uninsured, or or have lost their insurance during this time frame, that would really help us. We talk numbers sometimes. We're talking numbers that come to us from somewhere, maybe not even North Carolina sometimes. And we need to know what's going on in North Carolina so we can fix North Carolina. Thank you.
Yeah. And if I may just jump in for one more moment here, Representative White, I just want to thank you, and to obviously your colleagues that helped you on that. It's not easy always, and I'm just being candid to put your name on the bill like that. And everyone needs to understand that. So we appreciate the effort, and if anything, we definitely need a lot more help in advocacy, definitely on the Senate side.
Yes, and I think 2021 is going to be our year, folks. We're gonna make it happen here in North Carolina. And thank you all for answering that question in such a good, comprehensive way. And I'm now going to turn it back over to Malia, because we are running short on our time.
Yeah, so what we would like to do is give you both just a few minutes to speak on whatever you would like to close with. I think it would be helpful for everyone to know how to get in touch with you, especially Representative White. Thank you so much for that call to action for everyone to share stories and people that you know that do not have insurance. So if you could share with everyone what's the best way to reach you, and then anything else you would like to close with.
My email address is, of course, you can reach me through the NCLEG address, donna.white@ncleg.net. I also have I do have a couple of other emails if that one gets full. So it's donnawhitenc26@gmail.com, and that I get a lot of emails on that, but not as many as I do the NCLEG. So if it's something that you really need to get to me fast, it might be better to go through Gmail. My telephone number is 919-889-1239. And it has been out there in the public since I got on the school board in 2004. So I might as well just keep giving it out because everybody asks me. So please call me and let me know. If I don't answer, I'll get back to you as soon as possible. I want to thank Adam and Malia and all that had anything to do with putting on this event today. I wish that I could have listened earlier. I just got caught up with some constituents. This is a really busy time for constituents wanting to talk with you, and I'll say no more about that. But when they want to talk, it's good to talk with constituents. So, but I do want to thank you for having this. As a public health nurse, I just have to say that I'm sorry that we didn't get to all of the questions, and maybe if I hadn't been so long-winded, we would have. But I particularly want to talk about the partnership programs that we are funded through the budget in 19, if it had passed, and I believe in that maternal child partnership program. When I was at the Johnson County Health Department as a public health nurse, I was the pediatric nurse manager. And the Child Development Center, this shows how old I am, the Child Development Center was just being formed. And they came to me and asked me, would I develop a program, because they had observed me in doing a lot of different things and wanted to know if I was a very young nurse at the time, but I had worked in different, mostly in public health, since I'd worked in the hospital to get that experience, and then I worked in public health. So they asked me to form a program, and I did, and it was to meet with parents who were the kinds of parents that we're talking about today. For whatever reason, they just can't maybe necessarily give or understand what to do to help their child grow and mature, and and have a good solid education and solid mental health. So they asked me to develop a program, and I did, and we did it I have a team of folks working with me, and we We went over to our local mental health center when it was privately run, and we worked with these families and taught them how to interact one-on-one with their child and let them demonstrate in front of us different techniques. And some of these children had disabilities, IDD children. Some of them were just normal, healthy children, but they still had parents that needed some assistance. And that is one of the programs that Partnership for Children is still using today. They had no idea that it was formed back in the 70s, and that it came out of the Johnson County Health Department, and that I was the leader of that. So I just mentioned that to say that for a lifetime, I have been very interested and have learned as a public health nurse when we could actually go into the homes. And I don't know when that stopped. So I'm saying to whomever's listening out there, we need to put some of that service back in the local public health department. And my public health director, if she's listening, she's going to kill me right now for saying this. But we have a close bond and she does a great job. But I really believe that if we could put more nurses in addition to our counselors and social workers, but if we could put more nurses into the homes like we used to, our plan was for all children, not this special program I was talking about, but for all children, when they were born through the health department system, we went out before that baby was 2 weeks old. We went out and visited that mother. We visited the mother during their pregnancy. So we knew we could see the hot spots, we could see the red flags, and we were prepared as soon as that baby was born to step in. And we continued to visit about every 2 months. We would visit every month for 3 months, and we would visit more often if they were showing problems. But after 3 months, then we would visit about every 3 months or every 2 months, and that would go on until the child was 2 years old. And it was just amazing what that program did. And I know that the maternal child programs that we have in the Triad area of the state are very good, and we funded those. I put those back in our budget in 19 when I was budget chair for health, and we put it in the mini budgets, and we gave them more to touch it. So I believe in that program, but we don't need to just have that in a few places in North Carolina. We need to have that in 100 counties, and we could do that if we kind of restructured a little bit and let public health nurses do some of that. So that would be my wish for today. And I'm trying to be very available to constituents and non-constituents. So please let me know. Let me tell you that if I'm honored to come back in January, this will continue to be one of my top priorities. Thank you so much.
Thank you. Thank you very much, Representative White. Senator Davis, how can people get a hold of you? And is there anything that you have a call to action that you, in particular, you'd like to hear from constituents about? And just a few closing remarks.
Absolutely. First and foremost, thanks again for allowing us this opportunity to come and engage. And it's always just a pleasure and an honor to be able to join not only my colleague, but my friend, Representative White. Thank you. In terms of, I'm gonna step back because I really believe Representative White just outlined a lot of the policy issues that are coming forth, and things that often took a lot of work, a lot of collaboration to get there. But we don't just get here. This is a time now more than ever that I believe we must engage. As I was actually coming on early to the call, I heard advocacy. We must continue to advocate for those things that matter and to us, our families. And long story short, please know that as legislators, we are accessible. We're here. We want to hear from our constituents. So often, sometimes I run into constituents and that's like, oh, I didn't know if I could really talk to you or reach out to you. It's like, actually, it's the total opposite. We want to hear from you. We want you to contact us, on our private lines and emails if we give them out. And I certainly will share my information as well. One thing I would also address, while we talk about healthcare, Eastern North Carolina, rural health in Eastern North Carolina, one thing that is very important to me, and I would continue to encourage everyone to understand the significance, and that's the East Carolina University Brody School of Medicine. Right now, we're trying to increase the medical enrollment, but it's the model that is the power in this. What we know, the data supports this, and that is if you go into a rural community and you recruit students out of a rural community, you expose them to top-notch medical education, and then they complete their residencies within a rural community, overwhelmingly, they will practice in a rural community. And at the heart of this conversation is actually increasing access to health, and especially in areas when we were talking about earlier, the question, the barriers of transportation, all these other barriers that exist out there. This is about getting more healthcare providers out into our communities. It will take in each class the student population from about 80 to 120, so that we can again grow our capacity with the intention of keeping that capacity in our rural communities. So often I hear, kids, once they make it through and graduate, they want to leave and not come back. We want to provide opportunities for them to succeed in Eastern North Carolina. And when we do this, I believe our family is going to be stronger. We'll be able to address many more issues in terms of health, whether it's mental health, and so many more issues of concern. So that's one thing you'll hear me continue to talk about. That's very important to me, constituents, and I would encourage constituents to reach out to me as well. Any healthcare concerns, I would simply say that I'm always open. Please reach out, call. My cell number is 252-341-5548. Again, that's 252-341-5548. My email is Don Davis, all lower caps, 34 at gmail.com. That's my personal email. And just like Donna said, Representative, I've kept those. I've had that number for years, and the same email address. That's how you can get me probably sooner. Otherwise, please feel free to call the office at 919, and that's 715-8363. 919-715-8363. And then the General Assembly email is don.davis@ncleg. And I think they're changing them over now, Representative, to .gov. So they're changing all of our email addresses over. So please just keep that in mind. And it should be .gov, if not .net. But we're in the midst of a conversion at the General Assembly. You could please catch us at the General Assembly's website, because as we go through the conversion, I'm sure all that will be maintained and kept on the General Assembly's website. So thank you. It was an honor being with you today. And I'm just delighted. And I'm going to end on this note. You've heard that expression, and I'm sorry to use this one, but I'm going to use it because we're getting closer and closer to Thanksgiving. Either you're at the table or you're on the table. So speak up and advocate. Take care, everybody.
Thank you. Thank you so much. And it is, I want to say, it is so nice to see you both working together so well. I mean, I'm sorry we weren't able to see you, Senator Davis, but it's nice to hear you working together and really modeling that and inviting everyone to get in touch with you. We really appreciate that, and appreciate you taking the time to be a part of the Institute today.
Thank you so much, but all of you.
Truly an honor and a pleasure.
Thank you. Thank you. So everyone, you will receive, this is a recording. You will also receive a follow-up survey. Please fill that out and send that back to us. We have the last institute on October 26th. There's the link for the Survey Monkey to fill out the evaluation. Our final institute will be for the Triangle region on October 26th. You're welcome to join us for that one. Thank you all for being here today. We appreciate it. We've enjoyed bringing all of this information to you.
Thank you.